Hey, it's Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. And I'm always apologizing for that long winded name, but I'm stuck with it. What are we going to do? All right, well, first of all, tomorrow's Ash Wednesday. I guess today's Mardi Gras, that means. Wonderful. I don't know what you're doing. I think my proposal for this Lent is let's drop 10 pounds. Let's go easy on ourselves. Just 10 pounds. Just, take it a little easier as we get a little bit older. Well, today's topic is going to be about pregnancy related back pain. So what happens is we get a lot of moms who are pregnant and they work. So you can imagine being pregnant, already may already have a kid or two. You're pregnant and you got a back pain. It's not the greatest combination of things to have going on all at once. It does happen quite often. I mean, typically, with pregnancy related back pain, you're going to see a couple of main causes. All right, first of all, stress. So if you are a mom, you're going to have stress. If you work, you're going to have stress. If you're pregnant, you're going to have stress. So it's not too hard to see or understand as to why um, stress, be both emotional and physical, stress of pregnancy can really cause tension in the back muscles, leading to pain. There's also too is if you're a working mom. And yeah, again, this is basically all aimed at working moms who are pregnant. So they work, they already have kids, they're pregnant, and they got a back pain. Four different qualifying factors. So you can imagine they're under physical stress, the emotional stress, and they're sitting at work at their desk. It's easy for these back muscles to flare up and cause the pain that they're going to have in the lower back. Also, the pelvis too. Sitting doesn't help. Let's also take into consideration hormones. Hormones fluctuate during a woman's pregnancy. I mean, a woman who's listening to this knows that. Guys may not realize it, just be blind to the fact. But hormones are released that cause ligaments in the joints in the pelvis to relax, which can also lead to back pain, especially if you had an underlying condition. So it's one of those things that you got to be a little more cognizant of. Okay, so there's a lot of reasons why it's not just all of a sudden, hey, I have a good back and I'm pregnant now, all of a sudden I have a bad back. There's a lot of these subtle things that we have no control over. And now here's the one thing is let's stop for a second as far as the causation of pregnancy related back pain. Can't take medication, because it could affect the baby. So we're talking about these typical stuff that people jam down their throats on a regular basis. Your Advil, Aleve, your Tylenol, your aspirin. So you kind of Shit's Creek when you're a busy mom, you can't take medication, you work, you sit a lot at home at your desk, and you're pregnant. So there's all these pretty pretty uh pretty big storm going on there. Now, here's the thing too is you got to consider there are going to be postural changes as the baby, as the mom adjusts to the growing fetus. The center of gravity shifts, and the mom's posture can change, and this could put a big strain on the back as well, causing a lot of the back pain. And the one that's a little bit easy to talk about in the context of pregnancy is weight gain. So as the baby grows inside the mother's womb, so does the mother's weight, which could put pressure on the back and cause pain. So if you had to sum it all up, we got weight gain from the baby growing inside, lower center of gravity, postural changes that can also affect as the center of gravity shifts lower and lower as the baby drops further and further into the pelvis in order to be delivered, more strain, hormones, and stress. So what do we do about that? Well, first of all, I have patients come in that are pregnant, and I refuse to take X-rays as anybody should. I mean, on a woman who's pregnant, there's really, I think we can work around it in the interest of the mom's safety and the baby's safety as well. We just don't take an X-ray. I mean, hopefully, and most of the time, we do get the results we need that keep the pregnant mom happy and out of pain. So it's actually one of the more fun times in practice is when you're able to help a woman who is up against all these different challenges to stay pain free. Um, up until well, up until probably the beginning, halfway through the third part of the second trimester, we're able to have the moms lay face down on a table. After that, we have a special adjusting table. Now, if you're not familiar with chiropractic, you just hear talk about back pain for moms who are pregnant. Um, we call it the treatment table is an adjustment table. Chiropractic treatment is called an adjustment. So we have a special table just for pregnant women who are able to lay face down, even when they're fully, right up towards the end of they're about to deliver. But we have to take into consideration a number of different things. You want to be safe, you want to be comfortable, and you want to be effective for the mom and the baby. So, overly forceful adjustment techniques aren't necessarily indicated. I think you can go light and be effective. Because when a patient comes to me, again, I want to be safe, I want to be comfortable, and I want to be effective. And I think it's able to accomplish that using certain techniques. Um, I happen to be certified a technique called activated, which uses a handheld tool to move the vertebra. I use another technique called sacro-occipital technique, where we put blocks underneath the pelvis to shift the pelvis and allow, as you breathe, there's a rhythm between the base of your brain and the base of your spine. And inside there is something called cerebrospinal fluid. And the spinal fluid is like it's a cushion that goes all the way up around your brain between your skull and the actual brain itself. And it goes all the way down to your lumbar spine. And so it's a cushion filled with this fluid that's it's kind of very, very viscous, but it's cushiony. And what happens is that is by using this method called the sacro-occipital technique, sacrum being the bottom of your spine, occipital being the top. What you're able to do is you're able to really open up the pelvis and let some of the cerebrospinal fluid to come in to the areas that are being blocked, and that takes out some of the inflammation. If you take out inflammation, you're going to take out pain. And if you have pain, you have inflammation. You have inflammation, you have pain. So those two things go hand in hand. So there's different ways to mitigate it, but I think the treatment has to be very comfortable, very safe, and very effective. Also, too, is I think we like to add in some massage. Um, Not so much mechanical massage with tools, but more so massage using um, hands. Good old hand massage to relax the mom, and heat as well. So there are exercises for people to do at home that we can go into when the mom is here. That's tolerable. I'm not talking about a lot of exercises because many of the moms today who are busy working, they also exercise already. So there's a method to the madness in how you treat a bad back, especially if it's a woman who is a mom who's pregnant. So if you have a bad low back and you're pregnant, you're a mom, make sure the chiropractor you see has a lot of empathy. They don't keep you waiting. You're seen. You give it actually a little. You should get priority. I mean, if you think about it, it's only right. If there's somebody who has a chronic issue, who's not working, or maybe retired, and you're seen first. I think it's only fair. So I think you got to cut busy moms who are pregnant some slack. I'm Dr. Brian McKay. Core Health is located in Darien, Connecticut. We serve the communities of New Canaan, Norwalk, Stanford, and of course Darien. If you have any questions, my number is 203-656-3636. 203-656-3636. Hey, listen, have a great day, and don't forget tomorrow is Ash Wednesday. All right, talk to you soon. Thanks for listening.